Well, Tunisia is experiencing its most intense Covid-19 crisis since the start of the pandemic. Over the last week, we saw an average of 166 deaths per day and 7,500 new cases per day. It's worth remembering that Tunisia actually widely seen as having successfully managed the first outbreak of COVID in March 2020. It locked down its population early, and it managed to avoid the chaotic scenes that we're now seeing in hospitals here in the capital. We spoke to a young doctor from an emergency department at one of the hospitals here in Tunis, and she said that they were totally overwhelmed. She works in a room which has got 15 beds in it. There are 40 beds now crammed into that room, and she's having to make very difficult choices, having to choose between which patients she can treat depending on how young they are and their chances of survival, because she's running out of oxygen, there aren't enough staff members, there aren't enough beds, and the hospital is completely overwhelmed. Now, the vaccination drive is beginning to take shape, it's beginning to accelerate, and we're outside this vaccination centre in the capital. You might be able to see behind me lots of people in line waiting to get their jab, still very much focused on the elderly here in Tunisia. We can take you inside now to meet one of the doctors who's running at the centre, as well as some of the people who are getting their jabs today. This convention centre in the Tunisian capital usually hosts international conferences. But as the COVID-19 crisis deepens in the North African country, it's been turned into a vaccination centre.
Je crois que le moyen, c'est de vacciner tout le monde. Bon, ce ne sera pas facile, mais au moins on espère arriver à un taux de 50 à 60% de la population.
Et combien de temps il faudra pour ça, à votre avis?
Je pense que d'ici 3 mois, on arrivera à ce stade-là.
Tunisia is still at the stage where it's only able to offer vaccines to people over 50 years old, all those with pre-existing health conditions. Appointments are made online, and some elderly people have come here today to be vaccinated, accompanied by their children or even their grandchildren. To combat the COVID-19 crisis here, younger people will also need to be vaccinated soon, but some have told us that they're reluctant.
عمري ما زال قاعد نمشي للطبيب، قال لي حيزموا يلقح خافوا عليه خاطر نخدموا ونمشوا ونجوا في الدار برشا، يلزم هو يلقح على الأقل يحمي روحه.
وأنت ما تلقح؟
لا ما لقحتش أنا الحمد لله.
تحب تلقح؟
لا ما نحبش ماذا بيا ما نلقحش الحمد لله لاباس.
For the vaccination rollout to really take effect, raising awareness about the dangers of COVID-19, not just for the elderly but younger generations too, is necessary.
فما برشا عباد ماهمش مقتنعين اللي كورونا تقتل وكورونا، فما عباد مرضت ولا باس عندها مناعة قوية ما عندهاش أمراض مزمنة، هذيك من اللي تشجع في العباد اللي لا كورونا لا باس.
With COVID-19 cases at their highest rate since the start of the pandemic, Tunisia is racing against the clock to vaccinate its population. As you saw there in our report, the next challenge will be vaccinating younger generations. First of all, making the vaccination available to them, because with the exception of health workers, vaccinations here against COVID-19 are only available to those over 50. So that's the first task. And after that, actually convincing younger people to get a jab is going to be a challenge. Some, as you saw in that report, are reluctant to do so. They're not quite aware yet of the importance of having a population which is fully vaccinated against the virus. You heard the doctor in that report. He says that the only way for Tunisia to combat COVID-19 is to improve the vaccination rate across the country.